Hey guys, Dr. Childs here. Today we're going to be talking about how to tell if you are taking too much levothyroxine. If you don't know, levothyroxine is a thyroid medication. In fact, it is the most commonly prescribed thyroid medication. And if you have low thyroid, which is what it's prescribed for, you need to be taking the exact right amount. And if you're not taking the right amount, meaning you're taking too much or too little, you'll experience symptoms. Now, the symptoms you experience if you're taking too much are pretty much the exact opposite of those symptoms that you would experience if you're taking too little. And while most people are definitely taking too little, like in general, if we looked at all the people who have thyroid conditions, most people are not taking enough. There are some people who still take too much, and that's exactly what we're going to be talking about today. So if you don't know me, I'm Dr. Childs. I'm an internist. I specialize in treating patients with thyroid conditions, helping people with hormone imbalances, and of course, helping people lose weight. But today is about the thyroid. So let's talk about that. Again, these are the symptoms that you might experience if your levothyroxine dose is simply too high. Okay, so meaning you're taking too much. You may be on the right medication, meaning levothyroxine may be right for you, although that isn't always true. I have tons of videos explaining why levothyroxine may not be right, why it doesn't work for most people, and so on. But there are some people in which it will work, provided they're taking the right dose. So this is what happens. These are the side effects you might experience if your dose is simply too high, which would indicate, by the way, that you need to reduce it. The first non-specific symptom would be irritability. Okay, so taking too much thyroid hormone can definitely make you a little bit irritated. Thyroid hormone is really a Goldilocks hormone in the body. You don't want too much, you don't want too little, you need it just right. So if you notice that it's too low or too high, you can start to get irritable. Now, irritability tends to be more associated with the higher side of things, but there are some people who can experience if their dose is too low. We're including it here for completeness, but it is really a non-specific type symptom. Okay, so you can't just look at irritability and determine if your dose is high or low based off that alone. Another symptom that you may start to experience is hair loss. Okay, now hair loss can also occur with low if your dose is too low, but the hair loss that occurs if your dose is too high tends to be a little bit different. So you tend to start seeing the hair become brittle and you see it start to break. Okay, so if your hair is just falling, right? If it's just falling out, like when you're in the shower and you're showering your hair or shampooing your hair and it comes out, clumps and a lot of extra hair in excess in your hands, that's more of the low thyroid side of hair loss that you can experience. But if your hair starts to break and it's no longer retains its sort of texture or even the color or the style that it used to, it becomes brittle and it starts to break and crack, not just at the ends, but in the middle of the shaft of the hair. That's more of the hair loss that tends to occur in people who have too much thyroid hormone, which they can get from levothyroxine itself. I should also point out here that hair loss is a little bit tricky because levothyroxine itself can cause hair loss independent of whatever the amount that you're taking. So it can cause hair loss by itself, independent of whether your dose is too high or too low. But if your dose is too high, you're going to experience these side effects associated with the hair loss itself. So I know perhaps it's a little bit confusing, and hair loss often can be, but that tends to be what you experience when it's too high. The next one on the list is anxiety. So people who have too much thyroid hormone in their body tend to get amped up, right? They actually have fatigue, which is counterintuitive, but they have sort of a jittery sensation, a sort of anxious disposition. They can also be prone to panic attacks. So having too much thyroid hormone can trigger these panic attacks. And so anxiety tends to be more closely associated with taking too much thyroid hormone, and depression or having, depressed thoughts, slow thoughts, brain fog, that sort of thing tends to be associated with having a low dose. Another one is insomnia. So if your dose is too high, you're going to have trouble sleeping, okay? So it kind of goes up to what I was saying previously. When you're really amped up and you have this sort of nervous energy, which is, I think, probably a good way to describe it here, because you're nervous because it's anxiety and it's kind of a weird sense of energy, but it's like a fatiguing energy. It's not like you're jumping out of bed ready to get, tackle the world. It's a different type of jittery sort of nervous energy. And that sort of nervous energy can lead to insomnia. So you have a hard time calming down the mind. Your body just doesn't really relax. Your heart rate may stay elevated, which we'll talk about in a little bit. And all of these problems sort of contribute to the inability to fall asleep. So insomnia is definitely a side effect associated with having too much thyroid hormone or too much levothyroxine. Another one would be muscle weakness. Again, this, like irritability, is very nonspecific, and it can also be associated with a low dose. So don't live and die by the muscle weakness or the irritability. But you should be aware that an excessive dose of levothyroxine can cause some weakness. The next one is fertility issues. So this, again, can be caused with or caused by having too little thyroid hormone, meaning your levothyroxine dose is insufficient, or having too much. Now, women who tend to have fertility issues, who are taking too much levothyroxine, tend to have rapid cycles or rapid menstrual cycles. Okay, so if you have a hypothyroidism where your thyroid is slow, you may have like a 40-day cycle. Okay, now if you have too much levothyroxine, that may go all the way down to a 20-day cycle. So it's a rapid cycling, but it doesn't really allow for normal ovulation. The hormone cycles don't reach their peaks that they should. They're not declining at the rates that they should, and so on. So it really interferes with the estrogen and progesterone and those menstrual cycles themselves, and it accelerates the cycle. So if you have noticed, let's say, for sake of argument, normally you have a 30-day cycle, and you started levothyroxine, and you noticed that your cycle started to go for, instead of 30 days, it's 28 days, then 25 days, then 22 days. That is the sort of that's an indication that your dose may be too high, and it's impacting your menstrual cycle, which in turn will impact your ability for conception, right? Your fertility. All right, so the next one is a rapid heart rate. This one is very common, and this is probably the first thing that you'll experience. Now, what's interesting is you may not even notice your heart rate is rapid. So whenever I have patients take thyroid medications, especially medications that contain T3, I always have them take a resting heart rate. I like to just know what it is the first thing in the morning right when they wake up. It's actually really helpful if you have a tracking device. So if you have like an Apple Watch or a Fitbit or something like that, there's lots of them out nowadays. But if you can just track your heart rate over time, you can actually see what happens to it as you start your thyroid medication. And is it going up? Is it going down? Is it staying the same? And the change or not in your heart rate over time can help you understand how well your body is using the medication that you're taking. In this case, we're talking about levothyroxine, but this applies to all thyroid medications as well. Now, if you're taking too much thyroid medication, you'll notice that heart rate, starts to go up and becomes elevated, and it'll stay elevated, proportional to the dose that you're taking. Now, you really want your heart rate somewhere between 60 and 70 in the resting state, and once it starts getting to 80 to 90 and even higher, that's when you really have to look at your thyroid medication dose and determine if it's too high, because you really don't want a resting heart rate that is that high just at rest, right? I'm talking about you waking up first thing out of bed. You're not getting up and doing jumpy jacks. You're just sitting up in bed and checking your heart rate. And it should not be, 92, 93. That's just not where it should be. It should be almost the lowest it's going to be for the entire day, first thing in the morning before you get up and, do things. So rapid heart rate can be associated with, and often is associated with, excess levothyroxine, and is usually, among the first signs that you may experience. The next one would be palpitations. Now, these do not go unnoticed. Everybody, and in fact, if you ever had palpitations, leave a comment below, because these can be very freaky to a patient when they experience them. It feels like your heart is beating out of your chest, all right? And I don't think it hurts necessarily. That's not how it's described, but it's just the sensation that your heart is beating. Now, palpitations by themselves are not necessarily concerning. Okay, if you just have palpitations, it doesn't mean anything is wrong with your heart or anything like that. Okay, you're not having a heart attack or anything like that. But like I said, they're very concerning to patients, so they get freaked out about them. The palpitation is just that, though. It is just the sensation that your heart is beating. Now, what's interesting is you might think that because you're having a palpitation, that automatically means your heart rate is going too quickly. That is not the case. In fact, most of the time when I say, hey, if someone tells me they have heart palpitations, I'll say, okay, let's check your resting heart rate and see where it's at. They'll check it and it'll be 72, right? Or something like that, right? 74, 75, whatever. But the point is, they're feeling the sensation of their heart beating, but their heart rate is not elevated. So it's completely fine. But it's completely fine in the sense that it's not dangerous, but it can be an indication that your levothyroxine dose is too high. Okay, so keep that in mind. There is a difference between the two. Next up would be diarrhea, or just loose stools in general, okay? So it kind of depends on what your gastrointestinal function is at baseline. Do you tend to run more constipated or, having more loose stools? You kind of have to figure out where you fit on that spectrum. But what happens is as you take more levothyroxine, as the dose of levothyroxine increases, so too will the kinetics of your bowels, okay? And what that means is that they're going to move more quickly. That's an easier way to put it. So the more thyroid hormone you take, the faster your bowels move, and the decreased amount of time that food stays in your bowels, which means it increases your basically risk of developing diarrhea, okay? So it's proportional to the dose. The higher the dose, the more likely you are to get from loose stools all the way up to diarrhea. You can go on the spectrum from constipation all the way to diarrhea. It just sort of depends on the person, but realize that thyroid hormone speeds up the gut and it speeds up your bowel movements. And then last one, and this is another one which is very obvious, and this is definitely a telltale sign of having too much levothyroxine, and that is heat intolerance. So if you are taking levothyroxine and you feel like you're flushing or you feel like you're sweating, you feel like you're almost having hot flashes, those sort of things are all associated with heat intolerance. In fact, another good way to tell this is if you are normally cold all the time and you have a heater blow on your face, you got to get away from it, right? That's that heat intolerance. You can't stand the sensation of having heat on your body. Now, most of you listening to this will probably say, I love the heat. I need to be under the heat. That's an indication you need more thyroid hormone. Your thyroid hormone dose is too low, and your thyroid medication dose, if you're taking levothyroxine, is not high enough. But the opposite is true for those people who take too much levothyroxine. They have heat intolerance. They cannot stand to be in a heated environment at all. They can't stand hot air blowing on their face, on their body, or anything like that. So that would be one of the final symptoms. So these are all the symptoms and side effects associated with taking too much levothyroxine, which again is the most common thyroid medication used to treat all low thyroid conditions, including hypothyroidism, Hashimoto's thyroiditis, those people who have thyroidectomies, and also those people who are post-radioactive iodine ablation. So that's all I have for you right now, but I want to hear from you guys. Have you experienced any of these symptoms? Do you feel that your thyroid dose is too high? Do you feel that your thyroid dose is too low? Are you experiencing these symptoms right here? Or are you experiencing the exact opposite, which would indicate that your dose is too low? Let me know. I want to hear about your comments. I want to hear about your experience. And if anything is confusing here, leave a comment below and I'll do my best to get back to you. If you haven't already, make sure that you also download my free thyroid PDF resources. I have tons of information all like this, all designed to help thyroid patients feel better, get on the right supplements, get on the right medications, change their diet, you name it, etc. So that's all I have for you guys today. And otherwise, I'll see you in the next one.